So, to err is human. We all know about this. But can't robots make mistake? That's basically what I'm going to talk to you about. Now, this is one case of a friend of mine. This is a 15-year-old boy with a neglected AIS planned for surgery. Decided to go ahead with surgery with robotic assisted screws, looking at the magnitude of the curve and knowing that the pedicle morphology is going to be distorted. He was able to pass all the screws, including the apical ones, without any issues in the neuromonitoring. And the screws were looking very nice and robust. But unfortunately, lost potentials while correcting. Apical screws started pulling out. Eventually, he had to remove the apical screws, centralize the case, and call it a day. The patient woke up normal without any neurological deterioration, and he's doing well. So a potential disaster was averted. Now, the issues over here was basically the apical screw, not that the screw had breached the pedicle or was causing any neurological harm. The question that I ask is that would I have attempted an apical screw if there was no robo? Does impeccable screw guarantee a safe outcome? Here, you have to think about accuracy versus outcome. Not necessary if you have put accurate screw, your outcome is going to be as good. Here, you have to start thinking, what about human wisdom versus unnecessary confidence which a robo gives you when you have it? So, the thing is that error is something that is going to be a constant factor when humans are involved. To err is human. Errors during surgeries are inevitable. Can robots eliminate errors or do they bring new challenges? That's the question. Robots aim for precision, but are they infallible? The key question here is, are errors shifting from humans to robots? I'm not going to talk about philosophy. I'm actually going to go right to the statistics, the literature which is out there. We reviewed the results of robotic screws of multiple different systems that are out there. Clear advantages have been mentioned like precise screw placement, reduced radiation exposure, and decreased surgeon fatigue. The radiation exposure is actually significantly less, like as high as 70%. So robotic surgery offers greater accuracy and less radiation exposure than freehand procedures. It's clear. Robotic navigation systems enable the surgeons to operate with enhanced precision, reducing the risk of errors. This minimizes radiation for the surgeon and the patients. In fact, if you compare the techniques, the accuracy in freehand screw is just between 5 to 55%. Whereas with robotic screws, you have accuracy as high as 99%. But remember, robots also come with their own baggages. So it can be a double-edged sword. There are so many factors which come into play when you're doing a robotic assisted screws. Preoperative planning and image quality, robo calibration and alignment, surgeon experience and techniques, and patient anatomy and positioning. So where there are so many factors which are involved, there are so many things which can go wrong. In fact, it is known that 1 to 1.5% of robotic screws can be malaligned. And the conversion to manual technique, like improvising intra-op, is as high as 5 to 10%. The learning curve usually stabilizes after 30 to 50 surgeries, and then the surgeon achieves somewhere around a 93 to 95% accuracy rate while putting the screws. If you actually look at the clinical outcome of patients operated by robotic assisted screws versus freehand and other techniques, there is better pain relief with robotic screws. There is also better outcome as far as the oscillatory disability index is concerned. The intraoperative blood loss on an average is 150 ml less in robotic screws. The hospital stay is down by 1 day. However, with all the benefits, robotic surgeries also present challenges such as comparable complication rates, registration issues, and hardware malfunctions. If you actually notice, of all these different factors that are there in the literature, the only clinically relevant one is the intraoperative blood loss. Like 1 day extra in the hospital or the pain scores down by 1 point is not significant when you actually talk to a patient. There are so many factors which influence robotic accuracy and outcomes. Obesity and deformities impact robotic accuracy. Whereas we guys actually need a robo only for these type of cases, bad deformities and obese patients where it's easier for us to pass screws. Uh, Again, revision surgeries where previous surgeries have happened, there are registration challenges and higher chances of screw malpositions. Again, these are surgeries where we would really want robotic screws. On an average, it takes around 45 minutes more than other techniques, but then quicker recovery usually offsets the extra OR time. That's not really clinically significant here. What is important for everyone to know that robo has its own limitations. Up to 17% misplacement in the initial stages, which eventually stabilizes to around 1%. 7 to 10% cases aborted due to technical issues, and at the end of the day, high cost. Like robo is significantly higher than all the other instruments, that you have heard about in the past. Robotic assistance does make spine surgery look easy, but there is a thin line between confidence and overconfidence. Don't let the robo tip you over. Balanced approach wherein robotic precision with human intelligence is the best as far as outcomes is concerned. These are the references which I've used from the literature, and the stats are out there. Thank you for a patient hearing.